When were you diagnosed with ovarian cancer? That was
3 years ago.
Did they do radiation and chemo?
No radiation, no chemo. We just did a surgery to get rid of it. I have 3 scars, one here, in my belly button. No complications since, and we've been all good.
When did the SI joint pain start?
That was 5 years ago, and it got worse like when I started running more.
Okay. So the only reason why I'm going to do a abdominal exam is just to rule out, for my sake, sometimes ovarian, any kind of trauma that happens on the side of an ovary can refer pain to the SI joint.
Okay.
An ovarian cyst, which is benign, can also refer pain to the SI joint if it gets big enough. You never had pain though when you had it wasn't like you were linking it?
No.
And I don't think she's at risk because she says that it gets better when she rests and it gets worse when she's running. Most likely there's nothing to worry about, especially when you have cancer or some sort of cyst. It's pain that is unrelenting, as you know, and it doesn't change with how you move yourself or you position yourself. It's just pain. So I'm not worried about it, but I'm just going to show pretty much the audience like how a chiropractor would go and evaluate that before they would adjust a joint, especially since it's on the same side that you had the operation. All right, so go ahead and just stand up here for me and face the wall. And what you're going to do, we call this Trendelenburg test. You're just going to lift one leg up and then the other. Okay, so just hold the left leg up, knee up.
Oh, I have a bad balance.
It's okay. And down. And then the other side. And down. Any pain when you do that?
No.
There is. Okay, so when I'm assessing her sacrum here, there is a slight swelling right here in her SI joint. Okay. So that means it's irritated. Okay, so this is another clue that this is probably SI joint. Is that tender when I push there?
Yeah.
Yeah, there's swelling. No swelling here, no swelling here, and then there's just edema right here. Nothing over here?
No.
Right, there's nothing here. So that means, yes, there's probably some sort of SI joint dysfunction. Lift up the left knee again one more time, and it doesn't drop. So the joint should somewhat drop like this.
Okay.
And it's just riding high.
Oh.
Okay, which means it's lacking mobility.
Okay.
Okay?
Yes.
This side actually feels healthy and feels good. All right, so what I'm going to have you do for me is just take an awkward walk around the room.
Sounds good to me. Just take a nice stroll.
Just take a nice stroll around. I'm going to watch you walk. Yep, it looks pretty good. Okay, so for some reason, this is getting inflamed. I can reduce this inflammation here. Okay, like I could definitely decrease that and you'll feel better, but you won't be permanent.
Right.
If you keep running and keep landing on it, it's going to swell back up again.
Right.
So you got to come through here and really work on that.
Okay.
What soft tissue, get that joint. Do you feel the joint? This is called an SI joint. You know where you said SI joint, so
yes.
Okay, she's aware that there's such a thing as an SI joint.
Right.
Okay.
Yes.
A lot of people are like, what is that? What is that? So this is your SI joint. Is that where you say your pain is?
Yes.
Okay.
Yeah.
Well, the inflammation matches her pain. Okay. On your back, face up for me. I don't mean to bring back any memories or anything.
Absolutely, I understand.
But I feel
it's
bad.
It's gonna tickle.
Any tenderness in here?
No.
So here's this would be where your ovary is. Or was.
Yeah, right.
Any pain when I push in there?
No.
And then, how about over here?
No, it just tickles.
I'm sorry.
No, it's okay.
If you want, you can just push your hand down and I'll push over you. Any pain there?
No.
Any pain on this side when I do that?
No.
Okay. I'm going to do one more test and then I'll be happy, all right? I'll leave you alone. I'm going to push in, take a deep breath in. I'm going to push all the way in. Let all the air out. Now, normally, if it was like a cyst or anything, she'd be jumping off the table by this point. Taking a deep breath and let it out. Any pain there?
No.
I am right in there. Nothing.
Yeah.
Okay. You're good.
Cool.
Come on and have a seat. Face that way. Anything there?
A little bit.
A little bit?
Yeah, it's not
How about
terrible.
here?
No.
And how about here?
No.
There. How about here? Just like a little bit of an ache, or is it sharp?
It's not sharp. It's just kind of achy.
Okay. All right. Good enough for me. All right. Turn around this way. We're going to check out your neck. Do you want your neck adjusted? Okay. So go ahead and turn around. I'm going to figure out which way your bones are sitting.
Okay.
Go ahead and look to your right as far as you can. And then to the left. Any pain going one way or the other?
No.
Which way is more difficult?
The turning right.
Turning right.
Mm-hmm.
Okay. You have a lot of tension up here. Are you a student?
Yeah, I just graduated, yes.
All right, on your back, face up for me.
Okay.
Do you mind if I just start you out with the adjustment?
Oh, for sure. That works.
Okay. I'm going to do your neck, okay?
Okay.
We're going to get the scariest one over with.
Sounds good to me.
Okay, so just relax as much as you can. I've got you. Right here. Good. That's all that is, okay?
Okay.
All right, there we go. How did that feel?
Good.
All right. It should just feel like a release. We're
Yeah.
not done, but as long as I'm testing the waters here with the adjustment, make sure you're okay.
Mm-hmm.
She's still alive.
Yeah, I'm living.
All right, Jeanette. Oh, we couldn't get it. Sorry. Here we go. And relax that left shoulder. All right, good. We're going to do some of the soft tissue, okay?
Okay.
Oops, sorry with your hair.
I probably should have put it in a bun. It's long.
No, it's okay. So this is just more of massage stuff, okay?
Okay.
Shouldn't be anything uncomfortable. All right, here we go. Good.
Oh, what is that?
That's your levator scapula. It just is a muscle that raises your shoulder. Remember I said you had the shoulders that were from studying?
Yes.
If you don't like this one, we can
Oh, it's
move
okay.
on.
It was just weird. I felt it like, ugh.
It's very common. It's the
Okay.
first rib is up here, T1 rib.
Okay.
Okay, and the muscles kind of get really tight over that rib.
Okay.
And I always check this because it could reproduce symptoms down your arm.
Okay.
So I want to make sure that we don't. I do like a little exam as I go through, okay? And you're clear. I know it feels a little tight. That's common, though.
Mm-hmm.
But you're pretty clear. Just tension. It's just tight. Stress.
Yeah.
There's nothing majorly wrong here. So I'm just kind of working through those tendons, working through those muscles, okay?
Mm-hmm.
This left side isn't as bad as the right. Doing all right?
Mm-hmm.
Okay. I got you. Okay, I'm going to go a little bit harder over here and then we'll be done.
Okay.
With the neck. I want to hold that there. All right. So we're going to do the feet, okay?
Okay.
Ankle real quickly. Ooh, that is stuck. Okay. No, the ankles are really stuck near a side joint. There, that's better. Does that hurt?
No.
Good. reach overhead and grab the table for me. Just give me some counter force. Take a deep breath in and let it out. Perfect. That was the hip socket. Did that hurt at all?
No.
Okay, take a deep breath in again. Same thing, other side. Perfect. Ankle. That just doesn't. There it goes. Perfect. Okay. Now we can do face down on your stomach. All right. Any pain here?
No.
Take a deep breath in. Oh, yeah. Good. Excellent. I'm going to come in and do that one rib, okay?
Okay.
That's kind of out here. Take a deep breath in. Oh, yeah. Perfect. Very good. It was a little wonky there, but we got it. We got one here. Excellent. Okay.
I'm a little ticklish too, sorry.
Okay. I'll try to work with you. It's okay if you fight me. I will tell you that, okay? It's okay if you fight me.
Okay.
It's not like a massage where we're trying to make you relaxed. You tightening up doesn't actually hurt the progress, okay? That's a misnomer that a lot of people get confused. Yeah, you can go ahead and fight me. I'm not worried about that.
Okay.
Yeah, go ahead. I'm right here. Unless you absolutely can't stand it, then I'll
no,
stop.
it's okay, yeah.
I'm right in here. Let me see. I can't, ease you into this some other way.
The left side is always more ticklish than the right. I don't understand why.
Well, okay, so tickling is the predecessor to pain.
Oh.
Same mechanoreceptors, same proprioceptors, same, they're called nociceptors. Okay, and I know that's literally the word.
I like noci.
And nociceptors. So when they realize pain, the first signal to the brain is tickling.
Oh, love it.
So have you ever heard of tickling as being a form of torture?
Yes.
Yes. So when I'm tickling you, I feel kind of bad. I almost wish we would just skip the pain because it's almost like a little medieval torture here.
Right.
But at the same time, see how that's swollen? I want to try to get some of that swelling out for you. Let's try the scraping there, okay?
Okay.
But there's definitely swelling there. You can definitely get like a massage, okay, and get that worked out.
Okay.
This isn't an area where I go, yeah, just wail on it, I like to adjust it once just to see how it moves, but
right.
if you were to come back, I really wouldn't crank on that again. Unless I thought it needed it.
Mm-hmm.
Unless it was so out of place that I'm like, wow, she really needs that set over and over again.
Should I just keep getting massages then?
I would get them right here on your SI joints, and they call them piriformis release. Take it from the SI joint over to the iliac crest, and then down to the ischial tuberosities.
Okay.
And hip sockets. Okay.
Okay.
So the whole glute, the whole
Sounds
thing.
good to me.
And that's what I'm going to do right now for you.
Okay.
You will be a little sore tomorrow, but it shouldn't be too bad.
Mm-hmm.
If it is, let us know. Yes, that scraping just brings some blood in there, and hopefully that'll desensitize her nociceptors so I can get in there a little more. No, maybe not.
I'm trying so hard.
It's okay. I really don't. I just don't want to make it uncomfortable for you, but sometimes there's no way around it, and I gotta just get in here and release these nerves. So I'm just gonna go 3 times, okay?
Okay.
On this segment, and then we move down.
Okay.
Okay, so here we go. 1. It already moved. That's all we have to do. Fine. Right here. Here we go. 1, 2, and 3. Perfect. That went all the way down to your toes.
Yes.
Okay. Relax. We got it. There you go. Shh. Breathe. And we're going in the low back with the scraper.
Okay.
You're not bruising.
Well, that's good.
Not too much. A little bit here. There's a rib out. Spoke too soon. There's a little bit here. Well, that's why your parents are nervous about you, because of all the stuff you've been through.
No, right. Yep.
They have a reason to be.
Oh, yeah.
Okay.
Mm-hmm.
Oh, wow. Okay.
Is the right side just as bad?
As far as bruising goes, almost.
Oh, yeah.
Yeah, you're pretty bruised down here. But that's partly stress. There's no structural problem here. Well, kind of, a little bit. But it's not like, oh my god, that's the reason why she's in all this pain. No. I'm going to work a little bit over here on the right side. Well, let's do some skin pulling.
Ooh.
Because we're here. A little bit. That pinch too much?
No.
There's none there. Oh, that was it. I try not to like do that kind of stuff, but when it goes, it's like, thank God.
That was right. That was loud.
Yeah. People are like, you talked over the crack, and I'm like, but it was so exciting. You know, every little thing that we do, it's like such a like an accomplishment. It's like, yes.
Yeah.
Because you and me have to work here, and you and me have to decide what's going to happen here. All right, just working down the leg, okay?
Mm-hmm.
Is it too much?
No, it's okay. It's just ticklish.
Oh, no.
Always, every time.
All right.
Oh.
Done.
Oh.
Let me just get it over with then. Okay. Oof.
It's like worse.
This one's worse. I know. See, that's a little bit of a sciatica there, okay?
Okay.
All right, 1, 2, 3, done. Okay, I'm just going to press on the calves. I'm not going to do anything extreme. I'm going to press 2 hands on the calves.
Okay.
Here we go.
It's so ticklish.
Still ticklish.
No, it's okay.
Oh, shoot. Okay, how about this, that?
Oh, that's fine.
Okay. I'm like trying to figure you out here. What can she tolerate? What is ticklish? What is not? Okay, feet again. Just gonna stretch. There we go. Just kind of like, yeah. And again, yeah. There's little nerves here. Ow. Ow. Okay. You do have a little bit of a bunion forming on both feet.
Oh, no.
I mean, it's... Have you ever heard of toe separators or...
Yes. Mm-hmm.
You know, you might want to look into that. It's the beginnings of it. It's
Okay.
in no way, going to affect you now. I'm talking about like 20 years from now.
Okay.
And because the joint that you want to move, and I can show you when you get up, but it's this joint down here.
Okay.
It's not these.
Mm-hmm.
It's this one. So you put the toe separator in to pull that toe over.
Okay.
And it's happening because you're walking on the inside of your feet.
Okay.
So if you got like orthotics for the feet, so that you would work on more of the outside, sorry.
No, it's okay.
The outside of your feet.
Okay.
That would help you because when you roll in on this foot, it'll take this toe and push it over.
Okay.
All right, so this arm behind your back. Okay, we're going to go through these, all right?
Okay.
Take a deep breath in again. I'm going to push. Doing okay.
Mm-hmm.
I know. Owie.
That's okay.
All right. That's the worst one, actually.
Oh,
Right here.
really?
Yep. I don't know. I saw it and I went, well, let me get it. You're here. Ooh. All right, that's about as much as I can take it right there. I know. All right. And the other side. It's not too much here, though. You do have some congestion in the neck.
Oh.
But it's not, but you feel that.
Yes.
Your hair will cover it.
Yeah, right. It'll be okay. I'll just take my hair out the ponytail.
Aw. Gets a little warm, a little hot.
Mm-hmm.
Okay. I'm gonna wipe you down.
Okay.
How does it feel right now?
I feel my SI or in general?
Sure, both.
Both. Well, in general, I feel like loose. This feels loose. Like moving and being like getting up was a little easier.
Okay,
Yes.
that's what I want to hear.
Yes,
we're
it's
gonna
easier.
adjust it. Okay. So
Let's see it.
here's the neck.
Okay, that's not.
It's
terrible.
not terrible.
No.
This red, like this pinky stuff, will go away in about 30 minutes to an hour.
Okay.
These little dots are what stay there.
Okay.
A little bit here. This is what I know. I was kind of like, okay. It doesn't usually come out that low.
Huh.
And the shoulder.
Oh.
That was a little part of it that you said.
Yeah, I felt that.
That was right. Oh, and that's me earlier.
I love it. I love it. Yes.
Okay, so you can go ahead and put the shirt back on.
Okay.
Yeah, how did that feel getting up?
Easy.
Okay, I test you guys out. You're like, and I'm like, how did she
I
get
just
up?
went up. I was like,
Oh, how did she get up?
no, I like it. It felt a lot easier, like smooth.
Okay,
If that makes
you
sense.
just need to have that worked on. I'm gonna go ahead and do a little baby adjustment on it.
Okay.
Test the integrity of it, and then take a deep breath in and let it out. Perfect. Other side. How did that feel?
Good.
And slide you down a little bit. Okay. I'm gonna go like this. Good. You're gonna lean back. That's it. You got it. I'm right here on your SI joint. Any pain here?
No.
Good. Excellent. On your back.
Okay.
Move nicely.
Yes.
Move just where I wanted it, so I'm not complaining. And then bend your knees. You're gonna press out against my arms.
Okay.
5, 4, 3, 2, 1. And then squeeze my hands. Oh. Was that okay?
Yes, I felt like it was different. Different feeling.
Okay, squeeze again. Hard as you can. Come on, run our legs. There you go. All right, come on and sit up for me. You're gonna have your hands on your hips. These are all the cracks now.
Yes, we love it.
So come on and sit up as straight as you can and look up. And then elbow back.
That was phenomenal.
Yeah, let's see what the right one does. And back. Just your elbow. Just the elbow.
Oh,
Good.
I'm feeling my body's moving.
No, it's okay. This one is the one that I'm not sure about. It might not go. So hand on your, there's nothing wrong with it. Elbow, just your elbow. Good. Maybe I'll come back to it. Good. Renee feels yours. She sympathizes. She cracks her toes.
I love it.
Good. Lean away. Ooh, nice.
That was a good one.
I just kind of squeeze them out. I don't pull them.
Yank, right?
No. A little bit stuck over here on the wrist, so lean away from me. There it is. All right. Ears.
Ooh, I'm looking forward to this one. I'm nervous.
You're nervous?
Yes.
Oh no! They won't hurt. They get warm.
Okay.
Lean away. All it is. There's nothing there on that side. When there's something there, you'll know.
Okay.
Nothing there. That's good. You must not have had too many ear infections as a kid, or lean away. Feels good. No, there's nothing there. Sorry to disappoint you.
All right.
They're just like when it gets when there's inflammation in the ear,
Okay.
the ear will get like stuck to the head.
Okay.
And then I release that pressure.
Okay.
Because it can affect your hearing, it can affect how you hear, it can affect, like, you know, if you just change your ear one little iota,
Okay.
you hear differently. Come up and see how that feels. Like, you know, when you walk. Let me just see you walk around again. Oh, it looks much better.
It feels loose. Like it feels like easier to move, easier to like
Yes.
twist too.
It should.
Okay,
It should.
it does. It's like a lot
Yes.
better. Okay.
This is literally taking, it's like, sometimes the sacrum is the last spot to pull. Okay?
Yes.
So to take some of the pressure off of it so it stops swelling so much, you gotta get the upper body back. So you should be able to do something eventually. Ooh. I wonder if we got that on.
That was phenomenal.
Should be able to do something like this. Your knees.
Oh right.
Yeah, and then can you relax into that a little bit? There's not gonna be any more popping because I already got it.
Right.
You see how this opens up the chest
Yes.
here?
I can feel it now with the pillow. It's like a lot better.
Get off that way. Now come up, put your arms up this way. Now you're gonna roll to the side. Oh. Yep, there you go. Perfect. Take your time.
And it's such a different feeling.
Well, you don't usually work on opening up your chest.
Right.
We always are, you know, all day long our posture is just like this. So it is going to feel strange.
I feel like my back straighter, like up.
Right,
Like I
right.
feel up more.
Right, and this is half of it.
Okay.
Something, a fulcrum, anything. This is a little uncomfortable because it's so high.